MCNBOs. Welcome to my channel, Learning Builds Life. Today we are going to talk about clinical anatomy. So let's begin. This is a continuation from our previous episode. We will talk about omas. The suffix oma. The suffix oma indicates a tumor. Now you must be wondering, what is the meaning of the word tumor? Well, a tumor is an overgrowth of cells. Overgrowth of cells. And you must have heard of the disease cancer. Yes, and cancer is this overgrowth of cells. But sometimes mostly cancer can be spread throughout the body. But tumors are mainly benign. It means they can stay in one position. Some examples of omas are lipoma. A lipoma is a very common type of cancer. Not cancer, it can be rarely cancerous, but there may be tumors under the skin and the underlying muscle layer. That is lipoma. Next we have osteoma. Osteoma. Osteoma is a kind of tumor which is found in the bones, but mainly the skull bones. Skull bones. Next we have the scary neurofibroma. Neurofibroma is a type of a tumor. These tumors will be from nerve tumors, obviously, because the term neuro is there. Nerve tumors, which can be felt under the skin or on the skin. Nerve tumors. We have hemangioma. Hemangioma, which is a tumor which is formed by blood vessel type cells. Blood vessel cells. Those cells which make up the blood vessels, they mainly form hemangiomas. Lastly, we have carcinoma. Carcinoma. Carcinoma is the most common type of cancer. Most common type of cancer. Like lipoma, osteoma, neurofibroma, or hemangioma, these are tumors. They mainly don't spread, but sometimes they may spread and form cancer. But carcinoma is a cancer. So now you may take a look at the board. Moving on to puberty. Number 2, puberty. What is puberty? Puberty is basically development of secondary sexual characters. Sexual characters. That is puberty, but the age is different in case of girls in boys. For girls, it happens at the age of around 12 to 15 years. 12 to 15 years. And for boys, it is 13 to 16 years. That was all about puberty. The next term is symptoms. Symptoms are basically complaints of the patient. Complaints of the patient about the disease he or she is suffering. About the disease he or she is suffering from. You must have seen when people go to the doctor's clinic, and even you may have complained about some symptoms, like let's say if you had got a fever, you would tell the doctor that my body temperature is high, my head is paining, I'm getting a headache, my head is spinning. These complaints from the patient are known as symptoms. From these symptoms, a doctor finds it easy to understand what disease that patient is suffering from. So now you may take a look at the board. Moving on to signs. Signs, or physical signs. These are the findings of the doctor on that patient. The findings of the doctor. Like, for example, you must have seen sometimes doctors make patients lie on some crutches or beds, and then they start to examine them, like touch their belly to see if there is something over there, or check any part of the body they will try to feel. That is one type of finding. And also they might give you to do some tests, like blood tests, stool tests, etc. Those also that give findings to the doctor. From these findings, the doctor can finally identify the disease. And our next term is relating to identification, which is diagnosis. This is identification of the specific disease. Identification of the disease. Any patient is suffering from. And from this diagnosis, doctors can prescribe medicines and tell you what to do and what not to do. So that was about diagnosis and the signs. So now you may take a look at the board. We will continue clinical anatomy in our upcoming episodes, but till then, stay tuned. Please like, share, and subscribe my channel, and stay tuned for more videos. Thank you.